Okay, thank you, Alison.
Thank
I think we're going to move on to a last segment before we head off for the tea break. We're going to have a little bit of a role-playing session between a few of us, just to highlight some scenarios and how perhaps, individually as we are having a consultation with our patients, what kind of interactions, what kind of questions, and how we actually decide on the lens. I think there's no right or wrong way of doing this. You're going to see how we do it individually. I think open for discussion afterwards whether the right lens or whether you would choose the same lens as the individual doctors that from the interaction. So I think we're going to start off with some of the scenarios that's going to be coming up there.
So we're going to do 3 cases. So think of it.
I'm the patient, right?
So for the next session, we're going to do 3 cases, and my colleagues here will act as the doctor and as the patient, and one of us will moderate. So we're going to simulate real-life cases that we encounter. Think of it as like an ophthalmology meteor garden. So for our first case, we will have, let's welcome Dr. Munwai.
I'm the patient.
Yeah, Dr. Munwai Jerry Yan as the patient. And, Barbie Alison Chiu as the doctor. And they're going to role play a certain patient scenario.
Okay.
So on the screen, you can see the biometry of this case. Go ahead.
That's my eye. Yeah.
Okay, so nice to meet you. My name's Dr. Alison Chiu.
Morning.
I notice you've been seen by your optometrist. You have some cataract. Have you noticed the vision deteriorating?
Yeah, I think, I drive a lot at night. I'm a cab driver. I'm not sure if you remember me. I took you in my cab the other day, Hunted you down, I came to look for you because, I wanted my eyes to be sorted because my optometrist said that, I have cataracts. Now, the main thing I have really is at night, because I drive a lot at night, I work the night shifts, and, I have these glasses there, and one of the things is, it's just difficult to see, I can't see the road, I keep missing my stops because there's somebody flagging me down, but I don't see them because the light's just in my eyes. And, I went to the optometrist and tell me I've got cataracts, so what do I do now?
Okay, and so I noticed that you're a little bit short-sighted, so you wear those glasses to see in the distance.
That's right, yeah.
But, and you probably take those glasses off to read, do you? Or are they multifocal lenses that you're
These
wearing?
are multifocal.
Okay, okay.
But, I don't like them because, with the driving, you have the air conditioning on. Sometimes when you get out to help a nice lady with the bags and everything fogs up because, it's so hot outside.
You live in a tropical Asian country, yes.
Yeah.
Okay, so let's talk about what you want to achieve with the vision. It sounds like the halos and glares are bothering you.
Yeah.
You want some independence from the glasses or increased independence from the glasses.
Yeah.
So there are a few things that we can do with the vision. Would you prefer to prioritise your distance vision, so while you're driving, or your near vision, so being able to read without glasses?
Yeah, I think the job is important. I think, driving is definitely what I need for myself because, I work at night and, the family doesn't have any money if I don't get paid. So
It's your livelihood.
definitely driving. Yeah, I think, reading is fine. I think I can still manage, but I normally manage without my glasses anyway, except when I'm driving. So if I have to read a paper or look at my phone, I normally take my glasses off. They're even better than my multifocals, so
Yeah, but how would you feel if you could see clearly for the distance, but you needed to put reading glasses on to see up close?
What do you mean up close? How close
To
is
see
up close? Yeah.
at this distance here, to read your phone, for example, to read receipts in the taxi.
Yeah.
How would that feel?
Well, can I not have both? No? You're Dr. Chiu. I mean, you tell me you're the best, so give me both. Stop laughing.
Everybody wants perfection. Okay.
Yeah.
So, For the technology that we have available these days, and it's very good, you can have distance vision as well as intermediate vision, which I would describe as around arm's length, so that's your car dashboard. And you can have near vision, but there is a trade-off. And that trade-off is having halos and glares around lights, and they're most prominent around headlights when you're night driving. Some people don't mind the idea of that, and what I would say is the brain does go through a period of adapting or adjusting, but at the end of that adjustment period, which can take months, up to 6 to 12 months for some patients. At the end of that period, most people still notice the halos and glares there. So let's get a sense of, I need to get a sense from you about if you think that that's going to be tolerable to you, or if the halos and glares...
So I have to pick one, really. You're telling me that, aren't you? So I think, well, I'll pick driving, because, you know, I work at night. So that's probably more important. Now, if I can be able to read, you're telling me I'll still be able to read, right, without my glasses, but I might still need something sometimes, so a pair of readers.
I think you would have... I'm not promising you any near vision.
Right.
You may have quite functional near vision,
Okay.
but whatever near vision you have in low light conditions, it's always going to be more difficult. So you have a light in your cab, you can turn that on. You'll need to turn it on to see up close. But it may be that you'll need to put on a pair of readers, and I would say to most of my patients, expect that you will be able to put on a pair of reading glasses for close up.
Okay.
When I look at your biometry...
What's that?
I'm just looking at the measurements for your lens surgery. I notice your pupil sizes are a bit big. That's just something I need to take into account when I'm thinking about your lens. But you don't seem to have any dryness on your scans. Do you experience dryness, like dry, gritty, watery, stinging, burning, maybe
Not
even
too
sometimes fluctuating vision that clears on blinking?
Not too bad, no.
Okay.
Not something noticeable, no.
All right, okay. So I have a good idea of what the plan is moving forward, and shall I say my plan, or do we want some input?
Yeah, so we've heard the conversation between the difficult patient and the difficult surgeon.
Thanks very much.
So now we want the audience to vote using the Slido based on the conversation and the data. Which lens would you recommend for this patient? And then we're going to hear from Dr. Alison what her idea is. So let's vote. Scan the QR code and choose one lens.
There should be an option to refer the patient along, shouldn't there?
Yeah, we should refer. And there should be an add-on option at the bottom also. Okay, people are still putting in their votes. It's still moving. Okay, it's still changing significantly. All right, so I think now we have a stable refraction with this Slido. And looks like the majority of the audience will put in Elon mini monovision, and then followed by Elon emetropia. So, Dr. Alison, what would you put in this taxi cab driver who might be driving you to work the following day?
I feel like our audience here is so smart, because I would do the same as you. I would put an Elon in. I'm not promising any near vision, but because I like to under-promise and over-deliver every single time. So, because then you have far fewer post-operative problems, far less chair time. We know that. So I would do the same as you. I would do Elon mini monovision, but I would do the distance eye, the dominant eye first, and just gauge his tolerance to blur. So then post-operatively, first eye's done, great distance. I would be saying, just try not to wear the glasses lens over the eye that I haven't done yet. See what it feels like. At about 1 week, I'd be saying, how do you feel with the distance vision? Like, does it feel good with both eyes open? And if he says yes, I know he's going to tolerate, mini monovision because he's tolerating the blur from his non-dominant, uncorrected myopic eye that also has a cataract. And that will help me gauge how much to push the mini monovision. Also keeping in mind, he holds a commercial driver's license. So we want him to be able to pass his driver's license test. In Australia, I don't know what it's like here, but they test each eye separately for a commercial license. So I want to make sure that I'm getting him to about 6.9 in the non-dominant eye. So I would, on average, usually I'm about 0.75, 0.5. If people are tolerating it, I might push it up to +1. I think Munwai alluded to the same earlier. But, probably, 0.5, 0.75, depending on what the near vision's like post-operatively as well as the tolerance to blur. If he comes in and he says, it's too blurry, I can't see, this eye is good, the other eye is terrible, then knowing that he has a cataract in the other eye, then I would say, well, what about with the spectacle lens out of the eye that I've operated on? If the best corrected vision is still a little bit compromised in that eye, then still also he may be a good candidate for mini monovision. If not, then maybe just err on between 0.25, 0.5, because that's got a lot of overlap, very little loss of binocular, if nothing, and just boost the near vision a little bit.
Thank you, Dr. Chiu.
All right. Thank you. Give yourself a big hand, audience, for getting the right lens.
Hey, switch hats.
Literally switch hats.
Yeah. I think the trick is in the color of the cap. No, it's not.
I got it.
So we have the next case that's up there now.
Okay, so change in rules. Already I can tell this will be a difficult patient.
Perceptions. What gave it away?
I think the shiny skirt. But you're very well dressed. You look very good, and people who pay attention to the way they dress, they also pay attention to how they see the world, basically. So tell me, what are your symptoms?
I feel like I can barely see. My optometrist says that my vision is only decreased a little bit, but I'm very impaired. I can't see anything.
And what type of work do you do?
Well, I am an engineer, but I started out in physics. I also have a physics degree. So I'm really interested to talk to you about, the optics of the eye, because this is my first passion.
Yeah, that's the other red flag. Optical engineers, they're the worst. I think the only thing worse than optical engineers are eye surgeons. Well-dressed optical engineer. So what do you do in your day-to-day activity? What are your visual needs?
Well, I like driving, so I, need good distance vision. I race cars too as my hobby. Yeah, so I need good vision for the racetrack. But for my day-to-day work, I do a lot of analysis. I do a lot of reading. So I'm also doing a lot of close work.
And when you do your race car driving, how fast do you go, and do you drive at night?
I don't drive much at night sometimes, but I also have a little bit of dryness of the eyes, so it makes, the vision a little bit blurry at night time. Like I notice I have to blink to clear the vision. And so I don't really like that. Yeah.
So I guess in your work, currently, do you wear glasses at all in your current work?
Well, I wear contact lenses, yeah. And somebody gave me these multifocal contact lenses, and I could see really well up close. But the distance vision was terrible. So I actually wear some monovision in my contact lenses. Yeah, I quite like that. But I think maybe that's what makes it hard with driving at night. But when I drive, I always wear, on the track, I always wear glasses because, I notice that having the monovision doesn't work for me on the racetrack.
So is it fair to say that you're willing to wear glasses for some occasions?
No, I don't want to wear glasses. Can't you? can't you? I'm a physics degree major and an engineer. Like, I know what the technology's like. You should be able to do better than that.
Okay.
Can you give me? I want all vision. Can you make me like 30 again?
Okay.
With my vision.
See, that's the red flag.
Can you give me X-ray vision?
And nighttime vision as well. Good nighttime vision.
One's
Supervision,
X-ray
actually.
vision.
Okay, listen, I did do physics, so I know there's no free lunch when it comes to light. So tell me what you can give me. Tell me what the best solution
So we've
is for me.
got basically a few options, but just to make it simple, you're an engineer, but just to simplify things, we have two kinds of lenses. One we would say is a two-in-one lens, where you will have good distance vision, good driving vision at night, few chances of being disturbed by glare and halos at night, and you'll be able to see your computer and distance. But for reading, occasionally, if it's fine print, you may need to wear glasses. That's the two-in-one option. And then we have the three-in-one option where you can see far, medium distance, and you can read also. But there's a chance that at night, you may see some glare and halos, and there's also a chance that sometimes when you're reading, you may need more light.
So is that 3-in-1? Is that a multifocal lens?
That is a multifocal lens,
Is
a trifocal lens.
Is that like the multifocal contact lenses? Because as I told you, the distance vision was terrible. I couldn't see anything.
Yeah, so it would behave very similarly to the multifocal contact lens. Yes, but maybe a little better because since it's not on your eye, you may experience less dry eye.
Okay. Tell me about the materials. I want to know about the optics.
So the optics would...
No, I thought I was difficult, right? Bloody
Yeah,
hell.
normal patients don't ask.
You can see Harvey is sweating. Can we round it up, doctor? You have to decide something.
Yeah. So with the two-in-one, then what the lens does is it gives you good distance vision, and then it extends the way the light is focused, so that you have a more or less continuous range of vision for far and intermediate distance. So if you're driving, this is perfect because you can see the dashboard, your instruments. You may be able to see your maps as you drive.
And I would need to wear reading glasses to see my close-up work.
Yes, that's
my
right.
Excel spreadsheets
That's
and my...
right. If it's small print and not too bright, you may need that. And
Is there any compromise in my distance vision?
your
will I have
distance vision
crisp
should be good. It should be crisp. Yeah.
Okay.
But the three-in-one, there may be a little loss in sharpness of your distance vision, but you will need to wear glasses some of the time.
I see. This is the best you can do?
That's
I
the
thought-
best Thibault can do.
I was told you were one of Asia's best top surgeons in the world. This is the best you can do for me?
Well,
We start voting now.
yeah,
You're
that's
gonna vote to
that's
get
the
the patient
technology.
out of the room. No,
But
I think
if there's nothing better, put the blame on Thibault. Why he can't give us a free lunch? Okay, so let's vote.
that as we wait for the results, I think we do have patients like that. I think Alison's exaggerating a little bit. I think if she had a patient like that, she would have asked the patient to leave straight away.
Oh, we have
No,
worse
we do
patients.
we have patients like that,
Yeah,
yes.
we have worse patients because after all of that, they ask for a discount.
But that's every patient. Every patient asks for a discount. Well, at least in my
Yeah.
practice.
And
because
there's
they're
another
Chinese.
group that asks for installment basis payment.
Okay, I think still moving towards, well, a lot of people are going for the safe approach, I think, in this case, because you have a well-dressed perfectionist engineer that drives a race car. And I think you can obviously hear the fact that she was harping a lot about, you know, the quality of vision and the compromise, and she's a physics graduate, she knows about optics. So I think probably not many of us would put a trifocal in this case, because, you know, you're not going to get that good quality. You're going to get that, perhaps that bit of waxy vision, and you're just going to look for it. So most people are defaulting to an Elon lens. So Harvey, what would you do? Dr. Wee, what would you do for this patient?
If I don't want to see this patient too often, I'm going to put in the Elon lens. Elon with a little minimum vision. But again, we won't do it like a simultaneous procedure. We'll do one eye first, and then during the checkup visits, we'll get some feedback from the patient, and we are not above doing a mix and match system. I think for this patient, as long as the distance vision is good and she can drive her Ferrari at night at speed, that should be okay. But if she says after the first eye we'll put in an Elon, that her reading is deficient, then we may consider putting in the trifocal lens. So that's an option for the patient.
Would you do it differently, Alison? Would you do it differently?
This is what I would want.
Yeah. That's what you were asking, or hoping that he would say. Right.
All right, thank
Should we
you.
move to the last scenario
All right.
before a quick
Okay.
break? And I think Alison has to head off as well.
Okay.
So the trick wasn't in the color of the cap. So it was Elon. Elon's the winner so far.
Yeah, this is just a prop.
Yeah.
So now we have...
Right. So Mr. Harvey, good morning.
Good
Zao
morning, Dr.
Ni hao.
Munwai. Yeah, I came to see you because they told me you're the best doctor in Ipoh, Malaysia. So I flew all the way from Manila
To Ipoh.
to have my consultation and surgery.
Thank you so much. Have you had the chance to try our cuisine here as well? Just don't forget to do that before you go home.
Is
So
this-
how
this-
can I help you?
Well,
What is
yeah,
the problem?
so I'm a businessman, and I have a group of 200 workers, and I have 5 lawyers working in my department.
Okay. I needed to know that right from the beginning. Thank you.
Yeah, and I notice now I'm having difficulty counting the number of zeros in my balance sheet. Sometimes I think it's only 6 zeros, but actually it's 7.
Okay.
So now I want to see what I can do so I can improve my eyesight.
Okay, I see you're wearing a pair of glasses. Have you always worn glasses since you were young or more recently?
Yes, I've worn them since I was young, and I think the doctor tells me the grade is not the same. One eye is nearsighted, short-sighted,
Oh.
and the other eye is also short-sighted, but I also have a bit of astigmatism.
I see. Okay. I think we've had a chance to have a quick look at you earlier, and you do have some cataracts. So it's not bad, only a moderate amount, but I think if you're noticing problems, and we can't have you missing out zeros on your balance sheet, I think it's potential that we can do something for you. You have cataracts in both eyes, probably about the same amount, and I think you're suitable to have cataract surgery. So you have your cataracts removed, we can correct your vision. And do you tend to actually take your glasses off to read, or do you wear your glasses all the time?
Sometimes I actually take my glasses off to read. It's easier than wearing these progressive glasses.
Yeah, so I think nobody really likes progressive glasses. So when you do that, so presumably after surgery, you're thinking you're going to keep wearing glasses, or you perhaps want to be a little bit more independent?
I want to be free of glasses.
Free of glasses
I want to make
altogether.
sure I count all my money correctly.
Okay. That's great. Now, aside from work, obviously, where you have to look at the balance sheets, do you have any hobbies? What do you do for fun? Do you drive a lot? Do you play any sports? Or?
I don't drive. I have about 8 drivers, one for every day of the week and one in case one driver is absent. But I like to play golf and I like to play badminton. I have a lot of Yonex badminton rackets that I bought from Taiwan. They're very good.
Okay, so I think it sounds like you're very active as well. So now if I was to ask you if you wanted to be without glasses, and which of these activities would you put down to be the most important? Obviously, it sounds like it's counting your zeros, and that's up close. Would that be more important for doing that without glasses, or would you prefer you're exercising without glasses?
I want to do everything without glasses as much as possible.
Of course.
Yeah.
But if it came down to it, and I told that, because what we're going to talk about is the type of lenses we can use to correct your vision. And unfortunately, there's not one that will give you 100% vision at all distances. There's always going to be a little bit of a drawback. I'm just trying to find out if at any point there was a need for glasses, perhaps for near or for golfing or badminton, would you be able to accept it?
I want to have as perfect vision as possible, and money is no object.
Yeah, sure, but unfortunately, at this point, I think we do not have a perfect solution out there. You might consider that, that you thank you for calling me the best, but at the moment, I think what I do have available or what's available out there will not give you perfect vision at all distances. It'll give you very good vision. I think, for example, if you say I would like to make sure that I count my zeros properly, so I can give you a lens that can allow you to get good near vision. But there may be some compromise in the quality of vision. And sometimes, even though you don't drive, you do go out at night, perhaps sitting at the back of your Rolls Royce, you might look out the window and see a little bit of disturbances with the light and things like that. So there's some compromise. So I'm just trying to understand what's the best thing for you.
So what do we have to do to avoid the compromise? I really don't like compromise. I heard there's a good company in Hungary and they might come up with a better product in a few years' time. Should I just wait a few years?
I think you should throw some zeros at them to do more research and then perhaps they can do it better. I think really what you want to do is, as I said, we can give you good vision at all distances, but there may be some compromise. And the compromise being if we want to give you something that you can read up close better, count your zeros better, then you might have a bit of problem driving at night. But you don't drive, so perhaps that's not an issue. So what I would go for is probably something that will give you good reading. So something that will allow you not to miss out on your zeros.
So with that cue, we may vote now about what might be the best option for this money-counting, high-flying executive where money is no object, but also has very high expectations.
Yeah, with 5 lawyers.
Yes. So most of you are voting for Liberty Emetropia. Some of you are voting for Mix and Match, Liberty and Elon. So that seems a pretty clear leader with the multifocals. The near vision will be good. There's no night driving because of all the drivers. And with the emetropic target, with the activities like badminton, still good stereopsis for that fast-moving, high-paced sport. So what do you think, bilateral multifocals?
Yeah, that's what I would do. Bilateral multifocals,
I think that's a great solution. Good luck to you, Dr. Munwaili.
All right. Thank you, audience, for your participation.
Okay, so I think that, of course, is just some highlights of potentially some exaggerated scenarios. But, when you do refractive cataract surgery, you do have such patients. So hopefully that will give you some idea. As you see, it's a lot about asking questions in a way. I think we made it a little bit jokey. I think we are more professional, of course, during the real scenario. But we ask about hobbies. We ask about occupation. We ask about what is the compromise they're willing to accept. Is it going to be distance? Is it going to be nighttime? Is it going to be reading? I think all this helps us to decide what's the best option for them. So I think it's not one way to actually find this information out. You know, everyone does it in a different way, but there has to be some interaction, whether it be from the doctor to the patient, or you know, your staff, or they're trained to actually, you know, grab that information for you. So we're going to have a short break now. I think